Bismillah wassalatu wassalamu ala Rasulillah. Good evening, everyone. Welcome to our webinar. I am Dr. Mohammed Al-Eidi, Director of Accreditation and Institution Excellence at Al-Qasim Health Cluster. I will serve you today as a moderator of this presentation. We will be hearing a presentation from Dr. Ayed Rashidi, who will be speaking to us about a strategy for leading safer health care. Dr. Ayed Rashidi is a healthcare professional for quality and currently assigned as Vice President of Quality and Clinical Excellence of Qasim Health Cluster, based in Buraida, Al-Qasim region of the Kingdom of Saudi Arabia. Dr. Ayed Rashidi specialized in applying his expertise and quality management knowledge in healthcare quality, patient safety, and process improvement that constantly exceed the improvement goals of his client inside and outside Qasim region. Dear participant, kindly notice that the questions will be at the end of the session, and you can post it in the question and answer icon. So our speaker will answer it at the end gladly. Now we can move to our session. Please welcome Dr. Ayed to deliver the presentation on his very timely subject.
Bismillah ar-Rahman ar-Rahim. Thank you, Dr. Mohammed. First of all, I wanted to say thank you to the Saudi Patient Safety Center to give me an opportunity to be with you today for this presentation about strategies for leading safer health care. Welcome to everyone who attended with us this presentation, and we hope, inshallah, we will reach your expectations. Our general learning objectives, we have to talking about first to describing the highly level architectures of safety strategic, which will be supporting frontline leaders and organization in devising an effective safety program to recognize the different risk control methodology, to identify the importance of monitoring adaptations and responses in achieving safer healthcare, to discuss the ability to selecting between different strategic and understanding concept of strategy plan, recommendation to low and middle income countries in implementation of leading strategy toward safer healthcare. Let us to starting with perfecting to safety strategic. Let us to go to the first step. Let us both of us to imagining that we are working as a leader in organizations, and we are concerning about safety, and we have limited time and limited resources, and we got to be build and strategic in our organization. What's the first step? What we will do? Look to these questions. What should you do to improve safety in your organization if you are going to build an strategic there? First things, we want to review our safety standard, what available, what current situation I am working, and later on we're looking for any evidence I have it in my organization, what is I'm implemented there, like in any OVR reporting, occurrence fairness reporting, any precaution I'm using there, any checklist, any surgical, for example, checklist, whatever the safety I'm used there, I'm looking for it in the beginning. Second step, what safety strategies are available to you? As I said, you are gonna to looking for what strategy you are there. What is that you have a strategy related to risk control, you have a risk, you have a strategy related to best practice, improving the process, monitoring, adaptation of any guideline, whatever the strategy you have in your organization, you should to look for. Last things, or the third steps, how can these strategies to be most effective in combining? Sometimes we have many strategies in our organization, but maybe is not working to each other, and they are not well standardized in our process and in our culture in my organizations. From this, we ask him a question: what option do you have to improve the safety? We should be worried about modeling of all future safety interfaces. Most visible success in some highly standardized areas, like, for example, in radiotherapy nowadays, they have in highly standardized areas. Also, management of blood products, and also a combinations of automations and highly standard procedures combined to deliver ultra safe systems. In many organizations I have, or in many steps I have it, I should going through what is the strategic I have and what is the future safety I should implement it in my organizations. You have many areas, like, for example, radiotherapy, management of blood. You should also going through to make sometimes automation system or standardizing by using a checklist, tools, guideline, procedures to be sure that equal process in each area or each time in your organizations. All of us, we will look to these pictures. Please, through the chat, share with me what your opinion about these pictures. What do you think about these pictures? He's sitting alone. What's the problem with these pictures? Lonely, yes. Sitting alone, no support. Burnout. Okay, exhausted. Depressions. Okay, he's sad. Okay. From these pictures, psychiatric patient, let us to think about the psychiatric patient in my organizations. If we am a standardization process, I am implementing some strategic, it will be affected there or not. Here we cannot and we should not enforce the standards and the procedures in care of the patient and family. Here we're trying to do risk assessment for the situation and trying to have a system to anticipate and detecting of essentials, a problem and rapid response. When we are dealing with the human beings, we are trying, and as you know, the patient safety, our core business in healthcare systems. That means we are trying to looking for any system or strategies, how we are able to detect what that patient feels and how I will intervention to make sure he is receiving his care and in safe and in good quality. This is why we are different than other systems. We are in system need from us to have many strategic for safety, many standardization process in case of any process inside the organization. But when we are dealing directly with the human being, we have different situation we are able to do it. Like, for example, we should have a system to anticipate and detecting what that patient feels and what the possible intervention I'm able to do with. Is my intervention will be safe for him or not? This is my good question for that patient when I am dealing with a human being directly. Here we have 5 safety strategies we will cover it today. The first one is safety as a best practice, aspire to standards. And second one is improving the healthcare process and systems. Third one is mitigation planning for potential harm and recovery. Fourth one is risk controls. And fifth one, improving capacity for monitoring, adaptation, and response. We outline this 5 broad strategic, and this strategic is applicable to all levels of the healthcare system, from the front line to the regulations and governance of the system. And this strategy is able to implement it everywhere in your process, from the frontline staff who's meeting patient first, and also when going to the division directors or going to the CEO or going to the middle management, and also when you are going to the governors for any regulation related to that. As you see here, as the first two, these strategic we discuss aim to optimize care provider. We are looking for improving the healthcare. We are talking about best practice. And the others approach are focusing on management of the risk and trying to be avoiding the harm which will reach to the patients. Here we have the first board questions. As adherence to standards alone can improve safety? Yes or no? Please answering yes or no. Yes.
Now the response people, I think 23 answer by yes for this questions is adherence to a standard alone can improve safety, while 77 of people answer no, which is the right answer.
Correct. Related to the adherence to standards, as we said, remember the psychiatric patients, sometimes when adherence to the standards alone can not improve the safety. But we have to create an systems or strategies dealing with the human being and dealing with any situation need to be improved immediately. Okay, let us to go to the first strategic, safety as a best practice. Safety as a best practice, the most dramatic safety improvement, dramatic safety improvement for administrating of having been those with a strong focusing on the clinical. We are always looking for the clinical issues more specific to clinical process. They may be focusing on reductions of specific for harms, such as fall or central line infections, or increasing the reliability of the specific clinical process, such as pre-operative check. If we go to the intervention related to the aspire to standards, we are able to do an focal safety programs by reductions of harm, how we are able to reduce the harms in my organization by doing an interventions to reduce the central line infections, put it abundance, for example, intervention reducing urinary catheter use and infections. For reduction programs, we are trying to reducing the harms by this intervention. Improving the reliability of target process, like WHO surgical safety and other checklists, and also another medication reconciliations. Here we are trying to make complying with the proven evidence standard will be produce optimal quality and safety. Many patients come to harm because of established scientifically based on the standard of practice are not reliable followed. This is important for us when we are talking about how we go to the best practice. The best practice here is the suggest that teams, organization aim to believe that they can provide care in highly safety levels. We are trying to comparing our organization with a best practice organization is like a benchmark for me. When the same scope and the same service we are providing. Strategic number 2, improving work process and systems. Here we are trying to looking for any incidents. We are trying to make analysis for our systems. When we are doing analysis, we will find our area of improvement and how we can address it for improvement. We are trying to do analysis seriously incidents like RCA. Nowadays, any sentinel events, we should do an RCA, root cause analysis. Also now we are trying to near misses. When a number of the near misses is high, you are also, you should do an RCA to know what is the factors affecting, or what is the root causes or contributory factor to be able to be eliminated as much as you can, or to prevent it not to happen in futures. Like, for example, contributory factors related to patient, task and technology, staff, team, working environment, organization, and institutional environment factors. Many contributory factors will be affecting to be happen in my organization related to any incident will be happening. Okay, let us here to looking for example of contributory factors. For individual staff, what is related to the individual contributory factor? For example, in case of the staff, they are not trained, they didn't have a capability, or they are not able, or they didn't have the skills to do their work or to do this process. We trying to do training in a key clinical process. Any key clinical process, we should do a training for them, trying to staff has a good training and also we good competencies. Feedback on performance. We need to have a system to give us a feedback about the performance of the staff. We have a good monitoring system to do monitoring for their performance during their work, or annually, for example, if you are doing appraisal for each employee in your organization. Related to task, also sometimes the task is not clear enough to the staff. You need also to do standardizations and simplification of the process. Or sometimes we can do automation of our key process. This is sometimes related to task. For example, if you have manuals for medication prescribing, and you wanted to transfer to be electronic, or sometimes to put it in a table as a form of table, staff able to check, not only to writing, because to be eliminate to prevented illegible handwriting. Related to team, what contributory factor will be affecting related to the team? Team is need to be also standardizing the process when make structured handover system. SPAR technique, for example, when they are going to make endorsement shift to shift, staff to staff, and also you have a structured handover system able to protect the patient from any harms. Working conditions, you should have a good working conditions. You should reducing the reductions of noise and disturbances, and also you are able to make a good place and safe place for patient and for staff itself. Organizational interventions and the profile level of organizational staff is one of the important things we need to work on it as a contributory factor. Second questions, in your opinion, which risk control approach highly effective in achieving safety?
You can answer on the poll questions, please. Yes, now in poll questions, in your opinion, which risk control approach is highly effective to achieve the safety? Risk avoidance is 11%, loss reduction 11%, and risk transfer 0% answer. And the majority is according to situation. Select your approach, which is the right answer for this question.
Thank you, Dr. Mohammed. Related to these questions, yes, based on the situation, you are selecting your approach. This is what we will be see it during our next slide. Risk controls. Risk control, this strategy is quite different from the optimization approach discussed before. Here we're trying to mean many industrial safety is achieved by avoiding taking unnecessary risk or placing restrictions. In contrast, the healthcare rarely imposes limited even when safety is severely compromised. As you know, we are dealing with the patient. We are dealing with many and complicated systems. Sometimes two patients coming to your organization in same conditions, but the outcome will be different. Here, we wanted to how we can make risk control to each situation. I feel sometimes you are dealing with emergency situation for a patient, you should accept this risk because this is life-threatening situation. And sometimes you should do it, but you should be ready for that one. Availability of the ER equipment, availability of the staff, availability of everything, transferring system, communication systems, skills of the staff by training. You are trying to deal with the same, some situation. That means you are able to be accept this risk in case of happen. You are able to transfer risk to other, for example, organization, but sometimes you should deal with it because it's life-threatening, not like other systems, like an industry system. You will not be accept this one. You will shifted risk to other factories, for example, or industries or companies to deal with this. But patient in life-threatening situation, he's not wait. You should deal with it. Avoidance of risk is not necessarily a good option for patients. Either there are many circumstances in which a risky choice is entirely reasonable. However, risk control does not aim to prevent a considered risky or discussion or decisions, but to improve the chances of a good outcomes once the decision has been taken. This is, as I told you, we are trying to deal with the risk sometimes, even we have a good control to any risk, but we should system is ready to deal with any risk may will happen. I know we have a good control risk in some areas, but maybe we're not working in healthcare system. You should be ready for any risk. That means you are able to deal. For example, when we are put it a plan for disaster plan, or we are fire plans, whatever situation may will happen, and I make drill and training to the staff. That means I am ready for that in case it happens. And also we have connect and net connect with other organization in case if this happen. I'm able to shift the patient there, able to others hospital helping me in some equipment, some beds, some blood product or something like this. Regarding to the risk controls, some of risk control withdrawing services, this is happened by closing facilities if evidence of serious safety concern. During a pandemic of Corona, many facilities was closed because of that may affecting the patient safety or safety. Closing facility temporary while safety assessments are carried out. This is also sometimes you have some action to be taken to make temporary close to this process or this facilities till you are assessing the safety inside this facility, and after that you have able to retaining and open again. Happen also when we have any spreading in the infections and able to stop for 48 hours or 72 hours to make assessment. After that, you are able to open this facility again. We can also placing restrictions on services, restricting services either temporary or permanent. This is also sometimes we are not close the facility as a facility, but we will close some services inside these facilities. In case of they are for example, doing a service of open heart surgery, and there is many incidents happen to patient, and we can also make restriction in that services, temporary or permanently, till we are solve it and we improve it again to be open again. Sometimes we'll place restrictions on the individual or operations. Also, this has happened when we have doctors have a privilege, and this privilege to do these procedures, and maybe we are able to hold this privilege for this doctor. We will do this. We will tell them to make it under supervisions. He is not able to do it solo. That means this is one of the restrictions for individual not doing. Sometimes we are doing restrictions and privilege of prescribing some high-risk medication. For example, we put only the privilege the consultant able to be prescribing this or ordering this medication. Others, they are not able to do it till we under supervision of this consultant. This is one of the place of risk control to make restriction on the individual or operation. Prioritizations, selecting and emphasize safety critical standard, either temporary or permanently. Third bold questions, why resilience is important in healthcare?
So audience, you can answer on all questions. Why resilience is important in health care? You can choose one question, one answer. So the answer is 80% of attendees choosing the number one, helping staff to manage a stressful situation, protect them from mental health and improve their health and well-being. 0% choose the number two, and 20% choose the number three, and the right questions is the number one.
Thank you, Dr. Mohammed. Related to your answer is correct. Resilience is very important on our healthcare. We are dealing with, as I said, with incidents, failures in systems, but we should recover immediately. We are dealing with many, sometimes incidents, but we are able to go back to our normal situation, and also we will improve to more than our normal situation. This is very important for us to understanding in our system. Yes, we should have these cultures of resilience. We have a system able to be back again to the normal things, from system itself, from people who was working in that systems, the policies also, and procedure and guideline. They have also the staff there, and with the leaders, they have authority to sit together to change it in case of need to be improved something in that policies and standards. Yes, system should be has a good flexibilities to go back again to normal situation. And in many good healthcare system have been incidents, but how we are learning from this incidents, how we are able to be improved based on the data what we receive, how we are able to be learn from our learning reporting system, how we are able to be go back when we have any sentinel event happen, how we would be go back again to our policies and procedures to be improved and corrected based on that situation and based on our analysis. This is very important for us to build these cultures in our systems. Number 4, monitoring and adaptations and response. Once we accepting error and failures occur frequently in our systems or in our system, we need to be developed method to monitoring, adapting, and responding and recovery from failures. This is why we need to be flexible. We should accepting any failure will be happen, and we can how we trying to learn from our system related to that. Adapting and responding to problem happens all the time and is relevant to managers, firefighting to frontline staff. As I said, monitoring, adaptation, and responsive strategies, we are able to accepting our failure first. Second things, how we can do our root cause analysis, digging analysis to know why it's happened. Second things, do we have a system for monitoring, adapting, and responding to any recovery from failures? We have KPIs, we have guidelines, and we have control KPIs to know how we are recovering from these failures. This is the important things for our system to how we are dealing with any things of failure. Term of resilience is used very broadly in an attempt to describing and articulate the quality of safe organization and capacity to adapt and recover from extreme or unusual circumstances. This is what I said. Very important. We have this resilience cultures in our systems, and we are able to recover after we have any failure in our system. How we learn from our failure. This is one of the important things and how we are dealing with this. Monitoring adaptations and response. For example, if we're doing an intervention to our improving safety cultures, like for example, patient and family engagement. This is one of the important when I need to improve the cultures in my organization or in my healthcare system. Patient and family engagement is very, very, very important. Nowadays, they put it on patient and family councils, sometimes patient and family committees. And this is one of the engagement in your systems. Try to let them to participate in your decision, in your strategy. Trying to, you have an open culture. Let the doctors and nurses will be open with this patient to tell him about his care. Trying to let also the systems will be able to let him to have authority to stop any unsafe practice in case of the patient see it from the providers. This is one of the important things, culture of openness about error and failure. In case of happens, what is the system here in my organization, how they are able to deal with it. This is also monitoring, adaptation, and response in clinical team, rapid response to deteriorations. We are not waiting to say code blue or code yellow or code. We are trying to reaching to the rapid response systems or team inside the organization able to reach the patient before deterioration in this case. Developing emergency response system in case of an emergency, like manually by using a system to asking for in case of an emergency, they are able to be called, they are able to press any bell there, they are able to announce. This is the system. In case if you hear like this, that means there is some emergency situation. Also building a briefing and anticipation into clinical routines. This is also, we are able to develop a team cross-checking and safety monitoring. Cross-checking, like for example, double checking in highly risk medication when they are administered to the patient. Double check when we are transfusing of the blood to the patient. Before transfuse the blood, there is a double check between two individuals, staff working together. And the pharmacy also, when they are dispensing for outpatient, there is double check to make more safe our process for the patients. Strategic number 5, and this is the last one, is talking about mitigations. How is this strategic will be implemented in my organization? Mitigation is an action of reducing the severity, seriousness, or painfulness of some events. This is strategic accept that patient and indeed the staff will be sometime seriously affected or harmed during their healthcare. This is one of the most negligent aspects of patient safety. This is also need from us to work about these things, how we are trying to work in mitigation process, how we can reducing the harm impact to our patient and our system too. Let's also look for this slide. Level 1 is the patient. Rapid response and clear communication in case of something happened to the patient. Let us, for example, in case of something happened to the patient, incident reaching the patient, medication receives medication error or receiving medical errors, whatever the incidents reach to the patient, we should have a team directly responding to that incident and trying to communicate with the patient and to be clear and honest with the patient about what happens. This is one of the important. Designated follow-up, psychological and physical support. You should have a system for the follow-up, what will be happen. Also psychological, to sit with him, social worker, staff, they will be sit with the patient, with the family, and also physical support to be help him in case if you need help. Related to staff, the one who's made that incidents, the one who's involved in this incidents, we have to do peer-to-peer support programs. We need to be, what's problem? Because maybe he don't have the skills and ability to know or understanding the procedure and understanding the policy procedure. They are not have the skills to trying to, we are trying to help him by training him, support program for that. Also sometimes in case of this incidents, will give him a temporary relief from clinical duties. We can shift him to other place to let him to stay, for example, 10 days, 1 week, 2 weeks, 1 month, for example, till will be feeling good to back to his work, because we are not sure in case if we let him stay in same place, may again will be have an incident, for example, tomorrow or next week. That means we try to make a good program for him, and maybe we'll shift him not working in clinicals till we coming back in a good way and good skills. Related to the organizations, we have an insurance of organizations, legal protections for organization against unwarranted claims, capacity for rapid and proactive medical response. This is also one of the important things related how we are able to make sure about this organization and legally protect. Last questions, bold questions, is innovations are really safety strategies or safety strategy?
So you can answer on this question, is innovation really safety strategy? Okay, the result, for yes, 72%, and for no is 28%, whereas the right answer is the no for this question. That means they need more explanation about this question.
Okay. Regarding to the innovations, innovation can be defined as inventions, adoptions, diffusions. Nowadays, there's many innovations and many ideas and product services and pathway that has been clear benefit when comparing with the, what currently done. We have many innovations and many new process, like for example, telehealth, virtual clinics, and also using computerized systems, paperless, or many things. This one will be, but it's not an strategist. It will be help me, but you should understanding there is any new process it needs from you, carefully work, and how we be sure it's safe or not. Let us know what recent innovations in the healthcare, telehealth, the cloud technologies. Now cloud technology is used also by iCloud, for example, to make EMR, electronic medical record for patients. Also about virtual ICU. There is a virtual ICU here. Yes, it's good things to make virtual ICU or virtual clinic, but you should sure about the privacy and confidentialities of the patient information. You should sure about the doctor who's in the other side, and when he going and talking with the patient, is a privilege and he's the right doctor or not. Did the doctor alone or somebody with him? The one who's sitting with the doctor, has a privilege to sit with the doctor and to hear about the case of the patient or some information related to the patient. This is many things you should look for it, because may affecting the patient privacy, the patient security of his information, also may affecting his safety too. Also, artificial intelligence you have systems able to give you predictions about what will be diagnosis, what will be care plan future based on the information demographic, what will be entering in the system, and that's able to be this. Innovation is a good example of double-edged tool for safety. Innovation is a critical determinant and means of improving safety in a long term. But we should be careful when we implementing any new methodology or process or any things because may some risk or new risk in short term will be happen, but we trying during the transitions and disruptions. For example, in case if you wanted to implement in your organization an electronic medical record, or you wanted to be electronic prescriptions, when any shutdown will be happen to the system, where is the information will be go? Maybe you lose your information. The patient will be not wait to be received and again to go back to manuals. You should be careful about when has transitioned from manual to electronic. This is one of the things. Also, when you are implementing form, for example, or endorsement process, or policies, for example, you should make pilot and testing for these policies and assessing the safety related to implementation. May something will be happen, things not existing before, but when you implemented the new things, may something related affecting patient safety will be happen, and that means you need to be again design and implemented because not every innovation process or a new process will be good if you implement it in your organization. Maybe you need training for staff, training for the people who's working in that areas to be sure they are able to deal with this new process or new procedures. Selections and customization of strategies to clinical context. Many situations require a combination different approach. As we're talking about this 5 strategies, we need to do combination different approach, but that it need to be a clear how and why each strategy is deployed. We needed a considering how these strategies and associated intervention might be combined and in what proportions. Each clinical environment bring its own challenges and require a different combination. This is the important for us when you make current assessment to your organization and you want to implement these strategies. You need to look what is will be combined with each other. What I need, what I have, and how I can improve what I have. This is one of the important. Recommendation to implement it on leading strategies towards safer healthcare. The first recommendation, improve the system. One of the important things you wanted to go back from this presentation to your system and to your organization, improve the system. Look for how can I improve myself. Second things, how I'm reducing the burden on staff, simplification and decluttering. This is one of the important things when I'm doing simplification to make it more simple, easy, understanding by all staff. You do flow chart, you do and steps for any, because sometimes the staff, they are not have a time to read all guidelines. They are not have a time to read all these policies, and they are not have a time to read the procedures. But if you draw it in the flow chart, if you draw it like in steps, they are able to go there and work in it. This is one of the important things when you go back to your system or your organization to implementing and these strategies. Team training in monitoring, adapting, and responses. One of the important also, try to let your team, is very important to understanding how they are going to monitoring anything. In the case of incident, how they are monitoring after recovery from this incidents or recovery from these failures. How we can do adaptation and responses to anything. How we have a plan B for anything. How we can, in case of electronic shutdown, how we can go back to papers and is the paper available or not. 4 things, Patient and family as problem detectors. This is one of the engaging the patient and family in your system. Let him to be the one who is assessing your system. Let him to be assessing your outcomes by asking them, by making a survey, meet them, sitting with them, by focusing grouping, by let him to be engaged in your committees, to be a member. Also let him to be making a survey face to face, or you can through any technique by papers or by calling or whatever kind of tools you are using to assessing your outcomes on your system too. The last, our last slide, key point. This is very important today. When we make an outline of portfolio of 5 strategies for improving safety in healthcare, each associating with a family of interventions. As we talking about safety as a best practice, what I mean here, I'm trying here to improve a clinical process and standards. Second things, when I'm doing improving in healthcare process and systems, I'm doing here intervention also to support my teams, trying to improve my work condition, trying to improve the organizational practice, trying to improve my teams and individuals, and if need something to improve their capability to deal with a new process. Third one is risk control. What I'm going to look for in risk control. Placing restrictions on performance and demand or work conditions, restrictions for the process, restriction for individual, and have good system how we can doing and control and how we can accept in the risk itself. Number 4, improving capacity for monitoring adaptations and response. This is also, as I said, we need to be improved and training the people, make our system able to have a good monitoring system, KPIs, for example. Also, I have a recovery plans. I have a plan B, for example, for any things need to be there. Last one, I'm talking about mitigation. Mitigation here, I'm talking about how we are able to make in the planning for potential harm and recoveries. How we are able to reduce the harm, the impact of the harm in my organization. This is one of things needed to work in it and how we can able to implement it. This is also, we trying to also looking for any innovations, generally aim to be provided better or more efficient care for patients, but safety may be improved as first one said effect on the innovation. As I said, yes, innovation is good. They may help me in safety, but it's need from me during the transition periods, looking for the safety there. We are trying to be implemented, but also we have a system how we are monitoring our safety. Each clinical environment bringing its own challenging and require a different combination of solutions. As I said, each organization, each healthcare system, each maybe unit or department, they have own challenging there. Maybe they have challenging about system itself as a structure, policies, guidelines need to be improved. Maybe they have a problem with capability of the workforce teams, need to be training them. Maybe they have a problem with environment itself. They have a problem with safety structures. Maybe they have a problem with the communication. They have a problem with availability of some equipment, availability of some services to deal with any incidents or any risk situation. This is the my end presentation. I hope, inshallah, in all 5 strategies able you to go back to your organization or your department, and you are trying to be implemented, and also you selected based on your current assessment. Thank you so much.
Thank you, Dr. Aid Rashidi, for this interesting and addressing this topic. Now we need to have our discussing the questions on the question and answer Please, our audience, if you have any questions, you can type it down in the question and answer icon. I think we have some questions, Dr. Aid. We can discuss some of them. There is a question is written about what's the common cause of medication error.
Many things related common medication errors. One of the medication errors sometimes related to the communication, related to the system itself. Many of the medication errors related to illegible handwriting, for example, from ordering respective. Also sometimes related to the dosage form, related to the incomplete or using and some unapproved abbreviations. Also, sometimes medication error, it's related to something related to a system, maybe the communication between nursing and pharmacy related availability of some medication. Some medication error happen during the administrations, and from nursing side. For example, when you give the medication to the incorrect patients, because of you didn't have a good system for identification of the patient, and you give for the wrong patient wrong medications, not for the correct patients. You give him his medication because maybe related to the identification. There is a reference for medication error categories, but this is one. I give example related to the medication.
Related for also risk, there is a question: what are the source of risk identification?
Many risk. When you are assessing risk and you are able to make identification for the risk, you are sitting to do a survey or workshop together with your team, and you have sometimes KPIs, you have sometimes incidents, you have patient complaint or complaints. You have also sentinel events in case if you happen sentinel events during the years. You have mandatory reporting event, infection control reports, observations sometime during the walk round or patient safety walk round. You can also go through the meeting minutes of some key committee in your organization, morbidity, mortalities. You can also do an failure mode and effective analysis, FEMIA, for example. Many sources you have in your organization and able to be predict the risk, and you are able to take an strategical to be avoiding this risk or to be transferred to make any mitigation process to be deal with this risk.
So as last questions, I think we have questions because you are a certifier. There is a role. Is there any role for accreditation in safer healthcare services?
Again, please.
Is there any role of accreditation in safer healthcare services?
Yeah, sure. The accreditations, for example, in your organizations, if your organization accredited, that means you have a minimum implementation of quality and safety, patient safety. You have a standards, and the standard is required to be comply with the standard. That means you have a process, you have a policy procedure, you have and a document evidence, you have trained staff, and you have a good KPI to monitor this. I think when you are leading safer healthcare, yes, one of the accreditation is one of the helping you in implementing these strategies. This is because many standards required from you to be deal with the best practice. Many standards taking you have a risk management program, an efficient risk management program. And many standards talking about you have an OVR system or reporting system. Many standards talking about how you deal with sentinel event. Many standards talking about capability of the staff, qualification and skills. And many standards also talking about availability of structure like equipment and structure related to staffing plan or organization chart, policy procedure. That means more of our strategic is the accreditation will help us for implementation of these strategies.
Thank you, Dr. Aid. I think at the end of this session, we can, on behalf of Saudi Patient Safety Center, would like to thank Dr. Aid Rashidi and audience for their active participation. Also, as a part of Saudi Patient Safety Center effort to provide you with timely topic and interesting speaker, we appreciate it if you answering or fill the evaluation survey provided at the end of this session. Thank you for everyone. Thank you for people who are the audience with us. Thank you for Saudi Patient Safety Center for facilitating this lecture for the people.
Thank you, Dr. Mohammed, and thank you for Saudi Patient Safety Center to give us this opportunity to give this presentation. I hope we reach your expectation and we give you something as you are able to go back to your organization and you are able to implement it as much as you can. Thank you so much.